Ed Witness News reports from the Stanford School of Medicine, California. This is Dr. Cornelius Drey, Associate Director of the Center for Infectious Diseases. At his lab, Dr. Drey and his team of scientists have been tirelessly researching the secrets of a strange new strain of squirrel flu that has arisen in the Western Hemisphere this past week. Dr. Drey has granted us an exclusive interview. Ed Schmerling reports.
So could you tell us a little bit about the research you do here, Dr. Drey?
Why, certainly. Here at the Infectious Diseases lab, we've always got our hands full with the latest and greatest in superbugs and infectious agents. But as I'm sure you've realized, we have our best people working right now on the current pandemic of squirrel flu.
So how lethal exactly is this squirrel flu? There have been numerous reports coming out that it is in fact the most deadly flu strain we've ever seen.
I'm not going to sugarcoat it. It's terrible. It's the worst thing I've seen in my 40 years of research. But we may have some promising new results. We've actually isolated this strain from squirrels fed on campus and done some pretty extensive work in characterizing qualities of it.
Could these results lead to a cure?
I think it's early to say for certain, but we've isolated one of the key proteins responsible for the virulence of this disease. We actually have some pretty surprising findings that I think you should come to our press conference on Friday to hear more about.
So, Dr. Drey, what exactly has made this disease so hard to cure?
Well, that's a very good question. I think it's been a cat and mouse game of sorts with us and this virus. It just keeps constantly mutating to evade us. But we've been working tirelessly and assembling clues that should help us wipe it out once and for all.
Numerous squirrel activist groups such as Acorn and Nuts have recently burst onto the national spotlight due to your findings. How do you feel about this?
To be honest, I'm not really involved in the politics. I am a man of science.
Well, certainly we wish you the best of luck, Dr. Drey, in conquering this pandemic of squirrel flu.
Thank you.
And just to remind our viewers, the H4N2 strain of squirrel flu pandemic is showing no signs of slowing. So far, it has spread to at least 17 countries since arising mysteriously in the United States. The virus has a 20% fatality rate, so anyone with flu-like symptoms, including cough, nausea, aches, vomiting, and a fever over 105, is urged to seek immediate medical attention. We'll keep you posted as the story progresses.